Hello and welcome to Abortion Grief Australia's presentation at the Here Be Share the Heart conference. My name's Mary Boston and I'll be talking to you today about abortion trauma and the sound of silence, aptly termed by Shakespeare, giving sorrow words. The grief that does not speak knits up the o'erwrought heart and bids it break. So we'll be getting through a lot of information, doing a bit of an abortion trauma first aid. So abortion trauma, otherwise known as abortion grief, we'll be walking through abortion grief and healing. So dehumanisation and abortion, rehumanisation and healing. Abortion Grief Australia is a bit of a background. We've been going for 37 years providing abortion trauma services. I've been involved in the organisation for 18 years as a volunteer. During that time, I have been a counsellor on the crisis line. I've developed training. I've participated in training, and throughout that time, we've done crisis counselling for men and women. A fifth of our crisis calls have been from men, an area that requires further exploration and development, just to develop some services there. We conduct programs in community education to increase awareness and understanding of abortion trauma. And we also do professional development. So we provide training services, information brochures. Just last week, talking to someone regarding setting up a group therapy for women suffering abortion trauma. So our services are not just, most importantly, not just aimed towards people who are suffering but and very isolated, but also towards the doctors, the nurses, allied health professionals, counsellors, welfare officers, who are very isolated as well, and are telling us that it's professional suicide often to talk in this area, and but there is a message of hope. It is getting better. The prevalence of abortion trauma in the community is, there's 1 in 3 women who have had an abortion. And so, it is very difficult to ignore, and the tide is turning. The suffering requires support, and those supporters who are identifying it, particularly health professionals, they require tools to help them and to help them help the suffering. I should mention that moving forward, our organisation will be called Abortion Trauma Recovery. There's growing international research linking abortion to drug and alcohol abuse, depression, anxiety, post-traumatic stress disorder, psychiatric illness, premature death in the forms of suicide, accident, homicide, and natural causes. The British Journal of Psychiatry published what was Australian research, quite groundbreaking research actually, which was relatively unsupported by the media. And they found that these women who were born at Mater Hospital from birth to 21, so 21 was just the tip of the iceberg in terms of their age and their experiences. Remember, these women were very young and had been exposed to abortion. They were 3.6 times more likely to abuse hard drugs, and they were twice as likely to suffer depression and be binge drinkers. They combined women who had miscarried with women who had aborted together. So miscarriage is often a triggering event for abortion trauma. Then again, the same researchers compared no pregnancy. So men whose partners had aborted were compared to people whose partners hadn't, were twice as likely to abuse cannabis, light drugs, abuse hard drugs, and suffer a mood disorder such as depression. Just in terms of abortion trauma and a little bit of history, there's historic trauma parallels with post-traumatic stress disorder and child sexual abuse. So in that neither of those were new traumas, it took social movements for those traumas to be recognised. It was the anti-war movement following the Vietnam era that allowed those soldiers to explore their suffering without shaming them. And it took a number of years, since World War I to the Vietnam War, for that recognition to occur. And again, with the, child sexual abuse, where the victims often had case notes, a mile thick, and it wasn't well recognised. The victims were often looked on with suspicion, were they telling the truth, in regards to their credibility. And it took the feminist movement that allowed the exploration of the sexual abuse, which then evolved further to child abuse, which we're thankfully hearing about, this terrible trauma, how it impacts, how they can reenact. And people affected by these traumas, they don't tend to make good candidates for getting recognition, advocating for themselves. And that's where the importance of the medical, health and welfare professionals are critical in the exploration and understanding and development of the trauma concept, and strategies to help people heal. And so these social movements in terms of what's required for abortion trauma, it gave victims the voice up to a point. If they don't have a voice, they're silenced. So any trauma recognition requires the social movement where the victims are able to share, and it requires professionals, experts who are willing to explore. And the combination of those two things is what will get us recognition of the trauma. The problem with, the major issue with abortion trauma is the polarization. We're allowed to talk about the wrongs and rights of abortion, but we're not allowed to talk about the impact that it has on men and women in a non-political sense. So what we're doing is, when we don't let people share, we're isolating and we're silencing them. They don't share. And if they don't share and they're not giving their experiences, then we don't learn. And if we don't learn, they don't heal. So unfortunately, with the polarization of abortion, we have the trauma, we have the social unfortunately, the combination of social isolation, the denial in medical circles of abortion trauma, often due to ignorance, or just unawareness, the political incorrectness of talking about it, and media polarization, all leads to the sound of silence. These people are being shut up and they're not able to speak and share their experiences. Abortion trauma, just a little brief, the women feel lied to on many levels, which leaves an enormous wound. And it's a betrayal by the seemingly, how women read it, unsupportive or indifferent partner, the betrayal of the medical industry, who calls abortion healthcare, but leaves them with grief, depression, mental illness, and the betrayal by the community. With abortion trauma, for many women, induced abortion is a death experience. It doesn't matter what you think, it doesn't matter what I think, it doesn't matter what the government thinks. These women and men believe, they have an innate belief that what is destroyed in the abortion is a baby. And the more anyone goes into the dehumanizing platitudes, no, it's not, it's a clump of cells, it's not a baby, the more that you're silencing them, you're shutting them up. And as well-meaning as we may be, that's what we're doing. After the abortion, women tend to feel there's something that's just not right. They can, their general statements that they make is that there's a general loss of joy of life, that they can't enjoy just simple things in life. And they stop themselves from enjoying life. They often keep thinking in their heads, I'm going to beat this, I'm going to beat this, I've got this. And they keep working on in their heads, it's a fetus, it's not a baby, and often around them, people are supporting that. But after a while, it gets to the point where, that's not working anymore. And they don't want the feel-good platitudes. They're not feeling good. They don't want that condoned to them anymore or affirmed in that way. However well-meaning it is, it doesn't help putting it onto them. And so they need to be able to deal with the conflicts that they're struggling with. They need to take ownership of how they really feel. So they need to have the head stuff connecting with the heart stuff, which is the feeling, which is very painful. And so becoming a parent is obviously life-changing. You know, any zookeeper or game park, owner will tell you that one of the most dangerous things you can do is get between a mother and her young. And nothing prepares you for these feelings. You know, no one prepares you for parenthood. You can talk about it all you like, but until you've experienced it. You know, and I read something recently that the importance of language when talking about motherhood. When a woman is pregnant, you know, we say she's expecting a child, but yet she knows she already has one. The baby's on its way, but to them it's already here. She's going to be a mother, but to her, she already is one. When we consider this in the context of the abortion decision, it's profound and insightful window into a mother's heart. So the mother and child bond is the most powerful of all human bonds, and the father and child bond can be equally as powerful. And so we come across to the grief losses, these wounds. You know, abortion trauma is a new frontier in healthcare. Even though we've been around for a long time, it's still, you know, gathering momentum, but steadily so. We're all still learning, but in our many years of working in this area and our experience, you know, that we found that there are these three main wounds, these three major wounds that with abortion trauma, those suffering must deal with. And if they don't deal with any one of these, then they're not going to heal fully. They're not going to find that peace. So the loss of the unborn baby, which we've just covered, the fractured identity of self. So women who say they can never be the same person they were before they walked into the abortion clinic, they're not the same person that walked out. And it's like this invisible barrier. It's probably, you know, they find it very difficult to articulate, but, you know, that's a good way to present it. They're going on round and round in their heads. I'm this wicked person. How could I do this? And the women describe the death of their unborn generally in very gut-wrenching ways. I had a doctor explain it to me a month ago, very graphically, about how she felt that her baby died. And even for the most hardened person, but they have to talk about it, and they have to get rid they need to get rid of it. They need to get it off their chest. And the third loss is the spiritual loss. So you must be very, very careful with God talk. Everybody has a different value system, so many different value systems, so many different spiritual systems that people work from these days and find healing in different ways. But a lot of women are terrified and fearful of God talk, and after the abortion can become very anti-religion, very anti-religious people, you know, and sometimes say the things like, you know, God is punishing me. So it's just to be very aware when we're dealing with these women, to be very sensitive to that, because that too can shut them up. So looking at the abortion decision, you know, people say, you know, the one question that you get asked is, why would a woman have an abortion if she believes it's an unborn baby? And well, unfortunately, a lot of those abortion decisions are crisis decisions. You know, they're in a state of shock and confusion. They're supposed to be in control, you know, managing their contraception. You know, I had it all together. I blew it. I really stuffed up. And the reality hits. And there's nothing more frightening. You know, my first baby was unplanned. And, you know, looking ahead, life is never going to be the same. And it's very, very scary. And you don't know what to do. And if you don't have good role models or a support system around you, you know, it's very, very frightening, very scary. And often you get yourself into that situation, there's that loss of confidence and you feel stupid. And there's this internal pressure that we put on ourselves as women, but also too, there's the external pressure. So it's the decision the decision itself is very painful. Will I, won't I? And it's extremely painful. And so we just think, these women are thinking, no, if I just do it, if I just do have the abortion, I can get rid of this state that I'm in, this extremely painful state, get it over and done with, and I won't be in this state anymore. One woman said, she just wasn't in reality, and she said, I somehow believed that the baby wouldn't die in the abortion. So it was mainly because of the shock that she was in, and just the disbelief and the lack of support, and actually the mismanagement of the health professionals around her, but and just their general lack of knowledge, without judgment. But really believed that she would come out the other side of the abortion with a baby. So the doctors, another thing, you're uninformed. The doctor that that you've seen, that you've been visiting your whole life since you were a young person, and they're telling you just go off and have the abortion. Well, they must know better. They know what's right for me. They know me, and it all happens very quick, very short, very, very hard decision. And so what we do know is, while medical literature generally has contention about how frequently abortion trauma occurs, there's generally a remarkable consensus about women who are most at risk of psychological problems as a result of abortion trauma. And to be honest, those would be the unsure, the young, the traumatized, the isolated and dispossessed, those who have coping mechanisms and are already compromised, sexually abused, mentally ill, the health compromised. I was having a discussion with a lady who'd had aborted her fourth baby because she'd had an aneurysm and was advised to do so. Terrible trauma. Financial and developmental psychological limitations. And to be honest, the more that society thinks that abortion should be available to these women, the more contraindicated it is. So unwanted abortions, I think personally, I don't like that term too much. I think there's a lot of unplanned pregnancies, but it's a fallacy to assume that abortions are for unwanted babies. They're often for very much wanted babies, and the very nature of women makes them vulnerable to being pressured into having abortions for the convenience of others. We're always doing for others. So then we get into the dehumanisation. If there's anything that I want you to understand from this presentation and take away today, it's the relationship between dehumanisation, dehumanising women and men, and the abortion. I want you to get this because it's very important to know that there is then a relationship between rehumanization and healing. And so in all that we do, we respect human dignity fundamentally, and we don't get involved with dehumanizing people at all. So because the dehumanization of the unborn and the dehumanization of mothers occurred. Previous director Julie, she was always talking about Professor Nay and his work, and she would say that he was very onto this, and he talked about that you won't get a mother into the abortion clinic if it's a baby, and you first have to dehumanize the baby. And he went on to say that it's so much easier to do that if the woman herself has been dehumanized as a person. And these women don't often see the dehumanization. They're so hard on themselves. They blame themselves for everything leading up to, during, and after. And so then there's this strong link between, abuse and neglect, that they might make bad parenting candidates. And Professor Nay's not saying that post-abortive women, aren't going to be good mothers. It's that, or good parents, but that there's this cylindrical connection between those who are abused, finding abusive relationships or degrading situation, loose sexual practices, and ending up in the abortion clinic, and then struggling, if they do keep any children, to parent their children. So then we get into the trauma reenactment. So you think that, so the biggest predictor of abortion is the lack of partner support and that the mother had an abortion. So you think that the man that you've been most intimate with doesn't want to borrow it. And then there is this woman with the unsupportive partner, and they have this, beautiful, intimate relationship, and then he devalues her. And from that, one woman who we worked with, she would say, she was sitting in the abortion clinic and they've given her the papers, and she didn't want the abortion, but she said, I knew he would never accept it, and so I signed my baby's death certificate. And the trauma reenactment, you try to understand what went on, and you try to learn and to avoid it. It's part of nature to learn what happened and then make sure that it doesn't happen again. It's like watching, TV and having it on rewind, and you miss a bit, and so you go back and you rewind it and then you play it again, and so that you haven't missed anything, you understand. And as parents, we act out what's been role modeled to us. So, we might say something to our children, and don't do this, don't do that, or, and we swore we'd never do that, and we'd never say that. And then I think, oh, I'm just like my mother. And it's that reenactment. And abortion trauma, in a lot of cases, the mum's determined to get the daughter into the abortion clinic, and that she might not take her herself because she's not able to go there because of her own trauma. But if she hasn't managed her own trauma, if she hasn't healed, then it's highly likely that she will set the daughter up for the same failure. Never assume someone hasn't had an abortion. Subsequently, they set themselves up to repeat the experience, and they want to understand and overcome, and there can be a lot of collateral damage as a result of that. So abortion trauma typically presents, if you know a lady who's setting the table for her husband 2 days after he's passed away, think, oh, poor dear. If you know a lady that's setting the table for her husband 2 years after, then you think, we might have a problem here. There is a truth in the old saying, you have to say hello before you can say goodbye. I do apologise, the lights flick on and off here. The baby is often still there for most post-abortive women because they cannot say goodbye until they've said hello. And the denial, there's a lot of head stuff going on. So, the nurse might have tried to stop me, but she's telling herself all these reasons, but why she's gone ahead. But denial is a protective mechanism that allows anybody to get through a crisis. And I think a perfect example of that is like emergency services, the police or the firemen, and they'll attend a emergency, and there might be some horrific injuries there. Mutilation might involve children, and after what's called, they get into mode. They get into this mode where they just have to do their job. And the same goes with women who are in a crisis situation and just have to have the abortion, just got to get it done. But the difference in the situation is that if, the emergency services attend the crisis, response situation, they will be offered counselling straight away. Because what the services know is that they need to reconnect with their feelings, so that they need to share, they need to talk about it so that they can heal, they can get back to their job, they can be a productive member of society. In the case of abortion trauma, the women are often, will say, unfortunately, these women, if they come out of the abortion clinic and they allow themselves to think too much, they might suicide. And so, in a sense, if they stay in denial, they have to, because it's a safe place to be. It's not safe otherwise. If many people say, if I've had an abortion and it didn't bother me, classic case, one of my dear friends, 5 years ago, knew the work I was in, it didn't bother me. And a year ago, met a lovely man, wants to start a family, called, do you want to have a coffee? Wanted to talk about all about the abortion, the experiences that she had, the hallucinations she's been having, how she feels about herself. And so, you know, she's gone from telling me that she was so relieved to have the abortion when in actual fact she was experiencing abortion trauma. At every conference I've attended in the last 17 years, there's always that one person that comes up to you at the very end and says, I had an abortion, very, very aggressively generally. It didn't bother me, and is trying to convince you this. And this is fine, but there are all sorts of people that that you want to watch out for. Our society doesn't generally allow the suffering to connect. They don't give them that place to talk, to share. There's not a lot of sensitivity. So a woman who comes out of the clinic and she bawls her eyes out, absolutely lets rip, she's already connecting with it. And she's probably in the healthier situation than the woman who's holding on with control and denial. So abortion trauma typically presents in sleeping disorders, nightmares, hallucinations, visual or auditory, you know, anticipating disaster, something terrible is going to happen, always thinking something terrible is going to happen. Anxiety, very, very common, flashbacks, you know, so visually seeing children that are the same age as your child would have been, or had they still been alive. Hearing children crying, very, very common for women to say that. I've heard a number of women say that. The sound of a vacuum cleaner. Women can't use vacuum cleaners in their house, triggers. The dentistry. The smell of a hospital, avoiding hospitals, those memories. Or they can't go to a certain place and they don't know why. They can't go drive through a certain suburb, it might be where the clinic was. And so then we go into those triggering events. So you need to be very, very mindful of anniversary dates. It can be a very, very, very dangerous time. Again, they generally don't connect it. So they're not connecting the head with the heart. They haven't got in tune. So if you know people, they can, who have experiences, they can become quite suicidal, psychotic, abusive to their children. They might suffer gastrointestinal presentations, pains, issues around the time that the abortion anniversary of the abortion was, or the date that the baby was due to be born. Two very important dates. Lorena Bobbitt case in the US was a very famous case for this. She was in a very abusive relationship. She was forced to have an abortion by a partner. And on the third anniversary of the abortion, she cut off his penis. They were aware of this. The police were aware of this, very highly publicised, but that didn't make it into the media, obviously. Any death, uncle, aunt, relative, friend, somebody talking about death, anything to do with reproduction, particularly can be a triggering event, particularly menstruation. One woman just short of 20 weeks had an abortion, and she had the last thing she remembers is the blood on her legs. And so every month she has her period, and she has a major anxiety attack, sometimes for a day, sometimes for a week. Obviously, that's very detrimental to her life. And that's her triggering. Menopause, you know, there's always that thought of replacement. You can put the baby back, the replacement pregnancy. And menopause is an end to that, and self-healing are triggering. So we sort of, you know, you could liken it to AIDS, where you've got this initial health crisis, and then it tends to go underground. But it undermines your ability to fight illness. So you need medical support throughout the rest of your life. And, you know, with abortion trauma, it undermines your ability to deal with crisis episodes in your life. So what it is, you know, they're holding this trauma, and they're holding it down, and they're doing it often very, very well. And they're trying to keep it down, and they don't even know why they're doing it. And sometimes another trauma comes along, might be an issue with the child, might be anything, any one of the triggering events that we've mentioned today, and it overwhelms them, and they can't cope. So just a summary of the induced abortionist death experience for many men and women. The three major losses: the unborn, the identity and spiritual, the fractured identity and spiritual loss. The denial, isolation, silences men and women. It obviously has a delayed presentation, 5 to 10 years. It has triggering events that they often do not connect. And that's a big thing. They do not connect what's happening with them. They do not connect it to the abortion. So it often typically presents as self-destructive behaviours, replacement pregnancy, relationship problems, and mental health problems. And how we see this occurring is through eating disorders, alcohol abuse, suicide, abusive relationships, sexual dysfunction, risk-taking, repeat abortions, repeat pregnancies, and parenting issues. So really, really interesting. Death by suicide, Finnish study of over 1 million women. It was record-based, it wasn't survey, so very good research on young women, again, tip of the iceberg, because they were all under 25. And they found that of these women who aborted, they were 12 times more likely to suicide within a year. And I think that these were women who, as I recall, the pregnancies ended with either birth, miscarriage, stillbirth, or abortion. And they found also that they were 4 times more likely than women who hadn't been pregnant at all. So again, there was another research by the same doctors, some doctors in the US, and they did a survey on when women were most likely to have an abortion, to commit suicide after an abortion. And what they found was very, very interesting, that in the first to the second month after the abortion, they were highly likely to suicide. And also, again, when the baby was due. And again, anniversaries to remember. Very, very, very dangerous time for these women. So relationship problems, you've got the relationship breakdown, sexual dysfunction, overprotective in the relationship, domestic violence, child neglect and abuse, friends and colleagues, always pushing people away, always creating dramas, bizarre. So we have these relationship problems. The Yale Institute did a study on 260 women, and what they found was, there was this self-hatred, hatred of the male, hatred of men in general, and they were significantly correlated to each other. 53% of these women reported that they lost their temper more easily, and 48% they became more violent and angered after the abortion. The common scenario for the man is that he's excluded from the decision, or he feels excluded from the decision. He remains silent. She reads that the right way or the wrong way, but his silence is, loud. He didn't express his feelings. She internalizes, as women do, and she aborts. So then we have women finding themselves, and these women tend to stay in abusive relationships, and they may move from one abusive relationship to another. They gravitate towards anger and chronic rage experiencing for themselves. They're feeling of numbness, and they provoke conflict. Death by homicide, these women are getting themselves killed. So therefore, this was the same Finnish study, and they're 4 times, you can see on the first, people who have had no pregnancy with those that have had an abortion, and they're 4 times more likely to get themselves killed or murdered in the first year after the abortion. So with the sexual dysfunction, a lot of women become men haters after the abortion. So the person that they actually hate the most is themselves, and they are projecting it out onto the men. They're blaming the men, and they might marry Mr. Right, and that fella, he wasn't involved in the abortion at all, but they're taking their anger out on him, and they're going to punish him. And so a lot of women hate men so much and are so distrustful of men that they change their sexual identity. And I've also seen that happen, not just heard, I've actually seen it happen. I know a chap who married a post-abortive woman, and as a result of the trauma that happened in that marriage, he changed his sexual identity and has worked his way through that as well. A lot of women develop careless sexual lifestyles, and they don't take care of themselves, lack of self-esteem, lack of dignity, and it's self-defeating behaviour. It's degrading. They're seeking it to be degrading. They want to harm themselves, and it's and they feel like they deserve it. So relationship or parenting issues. So they have this guilt, grief, shame, and it's all consuming. They're unavailable. They don't have the emotional capacity to connect with the children. They're confronted and conflicted. They find all the the distractions in the world. The other children are in their face all day, and they're thinking about the one that they aborted, which might have been from a completely different relationship or situation. But that baby's always there. It's the head stuff. And things are going round and round in their head. And so they create distractions. They might become a workaholic. They might drink during the day, drink all the time. They create dramas. They create conflict. They encourage abuse of themselves, possibly of their children. They create blow-ups. It's like Days of Our Lives. Of course, their children can often be disconnected as well, which is part of the trauma. Which is the most rewarding part of this work, is that we often help people to reconnect through the healing with their families and with their friends, with their husbands, their relationships, and their children. Very rewarding. So the damage to a woman's maternal identity is often profound and insidious. With that confrontedness and conflictedness, they again, those children are in your face every day. Your other children, and you could be overprotective, disconnected, abusive, postnatal depression. Abortion trauma isn't always a result. Isn't always a result. Yeah, postnatal depression is always a result of abortion trauma, but can. So the replacement pregnancy, most interesting, that I find this to be, repetition is one of the greatest indicators of abortion trauma. And this is what I actually get asked most about in this. People just can't really get their heads around it. But it's a form of self-therapy, whether it's deliberate or subconscious, because they're not connecting the head and heart. The contraception fails besides their best intentions or precautions. They set themselves up to fail, basically. And it affects both men and women. And almost 50% of all abortions are repeat abortions. And that's why the healing is so important. And just in Western Australia alone, looking statistically, like our abortion rate supposedly since our last report has dropped. But when you look at the numbers, that's in your teenage group. But then when you look at the group between 26 and sort of 40, you notice that 50% of the abortions are from that category, and it's not going down. If anything, it's increasing. And so that's where you're seeing your repeat abortions happen, in that category. And those women don't have a lack of sexual education or access to it. Mental health issues can present itself in the form of compulsive disorders, postnatal depressions, anxiety, depression, personality disorders, schizophrenia. Abortion-related personality disorders are often very hard to treat. They want to mentally check out, and they don't want to be here. It's just too painful. The stages of grief, so Kuber's stages of grief, what we see with the abortion trauma is that they keep fluctuating, and they never get themselves out to that acceptance stage unless they do really, really good therapy, really, really good healing. And Selby did a lot of work with this and said that abortion trauma, there needs to be another stage in the stages of grief for shame and guilt. Obviously, chronic rage, we've already gone through that. And it's this toxic cocktail. So the unique thumbprint of abortion, at the presentation, with child protection a few years ago. Julie recounted to me, she was with a child psychiatrist, and she said that she was, sorry, with a clinical psychologist, and she said regarding that there was somebody spoke regarding the post-traumatic stress disorder, and they said with the soldiers returning, the vets act out their trauma, and they're very loud and abusive and antisocial behaviour. With the child sexual abuse, they tend to be very invisible, and they go into themselves. And with abortion trauma, it's the bizarre behaviour, it's self-defeating behaviour. We thought that she felt this was interesting because it really struck a chord with what they're seeing in this work. But it was relatable on a professional level, and did get a lot of discussion going. And the description of the bizarre behaviour here in the family court, why are they acting like that? You're going to lose everything. She's going to lose everything. I'm going to lose everything. Why are they trying to destroy themselves? And when you see that, you think abortion trauma. So again, just the wounds, many of the strategies involved to save people's lives over the centuries have been very, very simple. So we talk about rehumanization leads to healing. We're sort of going to zoom through this. And Dr. Ignace came up, he discovered in a maternity ward, you're washing your hands and you save lives. He didn't have any idea about germ theory, and that wasn't brought in until 30 years later. But at the time, the death rate of women in maternity hospitals was something like 1 in 3 in the 1850s. And by the simple act of getting the other doctors to wash their hands, they dropped that down to 1 in 50. But the other doctors didn't appreciate being told this. It was a thankless job, but he saved many, many women's lives. The poor fellow ended up in a psychiatric hospital and died, but still had an enormous impact on the health profession. And what we're saying is that you need to understand that abortion trauma with your emotional intelligence, is why academic people find it so hard and struggle so much with the concept of abortion trauma. Dr. Carl Brewer, he said that he made a very good statement. He said that, there we go again. He said that many people forget what you said, but they'll never forget how you made them feel. And it's very, very important to understand the subtleties there, and this is why it's so important in this work to stay out of politics in the area. Part of the healing is to rehumanize the unborn and the women. And unfortunately, politics dehumanize. And we must focus on rebuilding the women and the men, and rebuilding their relationship with themselves, with others, and with their baby. So healing is about feeling, it's a natural response to trauma. They have a grief, it needs to be healed, it needs to be recognised, it needs to be grieved. And it's like the infected wound. If you don't clean that thing out and you don't really scrape it out, it's just going to boil up, and it's going to cover, and it's going to burst out at inappropriate times. And there you have abortion trauma, a very, very complicated grief that needs to be grieved. So we talk about the journey from grief to healing. So you must respect human dignity, rehumanize. You must talk with sensitivity, and you must allow people to talk, and you must give them the importance of hope. Things can get better, because part of the process of the dehumanization is the loss of hope, the loss of love of life, any hope in life, and you can't live like that. And so you need to get them out of the head and let them start feeling. They must start to feel. So you need to give them a safe place to explore the pain, to be listened to. It's a deeply sensitive thing. They must be accepted. You have to validate them. You have to validate their loss. No matter how they present that to you, which can often be quite horrendous, you have to listen. You have to affirm them, and let them have a safe place that has no shame. So we give them hope. And when we give them hope, we throw them a lifeline. So you think about all of those decisions we talked about previously that lead up to the abortion decision. And we use those as part of the rehumanization. So the abandonment, the rejection, the shock, the loss of confidence, the fear for their other children, the fear of the loss in the relationship. We explore these issues and we get out all the garbage, all the rubbish, all of the things that these women use against themselves, that are hard on themselves, that they prevent themselves from healing. And so we rehumanize the unborn. Do you think it was a boy or a girl? Most people might have a name for it. They do have a concept of what gender it is, what they would have looked like. Most of them very much know what age their child would be, and what you would like to say to him or her, because it's generally a forgiveness thing. You use words to tend wounds. So you need to go that extra mile, because they hear you shaming them. They hear the condemnation. They're waiting to be judged. And so we listen and we use words that don't trigger a distorted response. We be sensitive. We be gentle. We listen. Non-judgment, because a lot of these women, as part of the process of dehumanization, have been deceived or manipulated as part of this process. And so for them to feel safe enough to talk to you, and for them to feel like they can share, we need to give them a safe place to do so. Delegation of responsibility in the re-healing, in the rehumanizing, it takes time, and it's very important, and it must be fully explored. It takes a great deal of personal courage and self-honesty. They accept responsibility for their decision, but at the same time, they delegate responsibility onto others as part of that abortion decision. They're very, very complex decisions, very complex. It's not something that you can take the full responsibility onto yourself. There are others involved in the process, whether it be a medical professional, a family member, a friend, community. There are so many people involved. So we encourage forgiveness. And so it's enormously difficult to forgive yourself. And it's enormously difficult sometimes to forgive others, particularly with abortion, where there's, it's a death experience and others are involved. So we have to accept our own humanness and the humanness of others. And we take ownership of the act. And that can be very challenging for these women. And, it really does take time for them to heal. And then there's the acceptance of what happened. And they're moving out of the denial, which is the head stuff, and they're moving into the feelings, the heart stuff. It's very, very painful. Heart stuff is painful. That's why they stay up here. But they integrate the trauma into their lives. And then their lives can become functional. They move forward. They do this with healing services, or they support others on their journey, which is often a very beautiful thing to witness. So we promote healing indirectly by speaking compassionately and sensitively of abortion trauma. There's things that are okay to say. So, I'm sorry to hear that, the unborn, my little one. Things that we try to avoid is probably most important things. The political statements, whether you're pro-life, pro-choice, pro-voice, that's not helpful. That shuts women up, silences them. Religious statements, feminist statements, anything that's regarding your value systems or might shut them up, we avoid. So we always speak and act as you would to any parent who's lost a child, regardless of what stage of grief they are in. And that's really what this is all about. So we're healing people, they're reconnecting the lost child. The key to what we want to be is sensitive to this reunion. And it is this reunion that is the ultimate goal and is the ultimate healing for those suffering after abortion. And thank you for today. And we're going to play something very special, some stories from those suffering.
Hello, darkness, my old friend. I've come to talk with you again, because a vision softly creeping painted scenes while I was sleeping, and the vision that was planted in my brain still remains within the sound of silence. In restless dreams I walked alone, narrow streets of cobblestone, neath the halo of a street lamp. I turned my collar to the cold and damp, when my eyes were stabbed by the flash of a neon light that split the night and touched the sound of silence. And in the naked light I saw 10,000 people, maybe more. People talking without speaking, people hearing without listening, people writing songs and voices never shared, and no one dared disturb the sound of silence. Fool said I, you do not know. Silence like a cancer grows. Hear my words that I might teach you. Take my arms that I might reach you. But my words, like silent raindrops, fell and echoed in the wells of silence. And the people bowed and prayed to the neon god they made. And the sign flashed out